Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, actual treatment of hyperparathyroidism. First, initial correction of because in hyperparathyroidism, because of increased parathyroid levels, there is increased calcium absorption in the body. So the patient will have hypercalcemia. So if there is hypercalcemia, we should do an immediate rapid correction of hypercalcemia is done with the help of rapid IV NaCl or sodium chloride can be used with furosemide, and followed by we can also do a neck exploration can also be done. But how are you going to treat the neck exploration? If the patient has, so the treatment depends upon the disease in the parathyroid. If the hyperparathyroidism is due to a Okay, if the hyperparathyroidism is mainly due to a single parathyroid adenoma, if it is due to a single parathyroid adenoma, then we have to resect that adenoma. Okay, if it is due to single only one parathyroid adenoma, we should just do a resection. If it is due to two parathyroid adenomas, even if it is due to two parathyroid adenomas, again we should resect the tissue. Then, if it is due to the hyperplasia of all the four glands, if it is due to the hyperplasia of all the four glands, that is when we have to see the treatment. If it is due to the hyperplasia of all the four glands, in such cases, number one, we should resect almost 3.5 glands. Okay, or either we can resect 3.5 glands, or we can either resect all the four glands, and one of the parathyroid gland is implanted into the brachioradialis or subclavius muscle. So we will resect all the four glands which are present are resected, but three are removed. But this one is auto transplanted into the forearm in the brachioradialis, or it is either auto transplanted into the sternocleidomastoid. So how do you auto transplant it? This one piece or this one parathyroid gland, it is actually made into around 12 to 14 pieces of around 1 millimeter diameter, and then it is auto transplanted. Auto transplantation of a parathyroid gland into the forearm. Auto transplantation of parathyroid gland is done by making it into 12 to 14 pieces, with each piece having a diameter of 1 millimeter. Okay, so this is one thing.
thank you and thank you for watching.